So, reaching the unreached. As you know, in the developing world, it's very important that we should be able to cover all sections of our society, including those who may not be able to afford cutting-edge ophthalmic surgery. Forward कैसे करेंगे इसको? So basically, when we started our practice in 1990, we formed a trust called ARUNODAYA Charitable Trust. The word Arunodaya comes from Sanskrit and means the first rays of the sun. And we founded a small organization. We saw our first patient under a tree, and from there we grew to now cover 1.6 million patients. Now about our organization, as you can see, the objectives are to reverse the tide of avoidable blindness, increase eye care awareness, especially in the lower sections of our society, knowledge and skin transfer amongst friends of ACT, and provide comprehensive eye care to the community. So this is how we run the program. We have a base hospital, and then we have a village outreach program. We have a school screening program. We have a mobile ophthalmic unit, and we have satellite centers in Delhi at Mataka Mandir, and we had one before this in Jharsa. So you can see that the base hospital is linked to all four of them. So basic services are given in the peripheral centers, and as mentioned in the slide, and those which we do not give in the peripheral centers are then transmitted to the base hospital. Now during the pre-COVID period, that's very important because COVID changed a lot of things. In the pre-COVID period, we used to have a village outreach program. You can see some of our patients are waiting there for the team to arrive for the screening, because we would advertise a couple of days or a week before that a team would be coming. And what we tried to do was awareness building, patient sensitization. Then we used to have campaigning to make awareness, training of local volunteers, conducting comprehensive eye care camps, providing free glasses and eye medicines where required, and referrals for investigations like OCT and surgery were required. So we also gave a healthcare and eye care education to them. Now, you take the case of visual acuity, refraction, a detailed eye examination. Now we even carry a portable slit lamp and a portable non-contact tonometer with us, and then giving them counseling for glasses. So you can see how many villages have been covered in the district. This is a Google map that was created by Dr. Aditya. Then we had the Netra Jyoti Abhiyan. Now this is a program that was started with the idea of taking our vans into the villages, providing services in the van, because we had places where we did not even find a roof to be able to hold a camp, and bringing patients back for surgery to a hospital, which you can see in the background. So this is how the vans were equipped. They had an ophthalmic chair, equipment, and we were using them. So you can see how Dr. Weber was there examining a patient. Dr. Aditya used to chip in if there was a shortage of optometrists, and we would all help out to do it. Please come forward. So we also did a very interesting program called the school screening program. And we are happy to say that this has also been copied by the South African Society for Prevention of Blindness. Mr. Kruger had come down here, and we have a long link with you. In 1992, we had gone to South Africa for the first time, where we met Dr. Koenig, Harold Koenig, at the Pretoria Institute at Schumann Street in Pretoria. And then he came and conducted a workshop at the AIOC 1994, where he taught phaco at our hospital to doctors who were just learning phaco. He is now retired in UK. And his colleagues used to be Jan Talma and others that way. So this project is called They See, They Learn. It's based on training of teachers. And the teachers are trained through an e-chart, which I think a sample is with Dr. Aditya. And through that e-chart, you'll see at our hospital, we would train the teachers, and then they would check the eyes of the students. So if there are 2,000 children in a school, you normally expect around 20% to have a refractive error. And that will save a lot of our time and effort in doing that. Then we used to conduct pediatric eye care camps. Then all students who we saw there, because the government regulations could not have a cyclopedic retinoscopy, till we referred them to the hospital. So we would do a dry refraction where the prescription was more than 0.5 spherical, myopic or hypermetropic. Only then we were giving them glasses. Otherwise recommending that they go to the local government centers and have a checkup done. And then of course we also had a program of giving them education through an e-chart. Even do now also in the hospital, we'll show you, whereby you go home as a patient and check the eyes of the surrounding people, because they already have an entry into the community. So for a new foreign body to go into the community takes a long time, but if you use local community services, you'll find, like politicians, you get a better result. So this is how we do the retinoscopies, the autorefractometries, and eye examination by our doctors. And the school screening program was held in the rural schools mostly and in the government schools. And we covered around 60,000, Dr. Aditya? 60,000 children were covered out of that. And I think we show you the figures also. That's the one. So schools covered 124. Children that were screened was 60,740. We gave away 6,890 pairs of glasses with support from SABIC. And 1,943 children were referred to for further treatment. So we run satellite clinics. We run 2 of them. These centers are aimed to identify and screen patients who can't base access to the base hospital. So they give referrals for surgery. Yesterday, Thursday, I was there at the referral clinic because the boys were here. And we had 47 patients and about 4 cataracts and 2 patients with diabetic retinopathy. So, you can catch them at the doorstep. So you see that's a reception of the Mataka Mandir clinic where I was telling you I was a Thursday afternoon. And people seeing the patient during COVID. Dr. Aditya examining a patient there. These are the primary health centers in Gurgaon where you're coming today in the evening. And where we network with the primary health centers. And so we have about 12 of them. These are places where the poor people or the local villagers go for cold, cough, and we give the eye care services. So in the post-COVID area, we developed a vision center with support. And you can see that the vision center was catering to patients. Unfortunately, we couldn't run it for very long because we lost the funding for it after a year. And this is the hospital. It's called the ARUNODAYA Deseret. Aruna, as I told you, is the first rays of the sun. The word Deseret comes from the Book of the Mormons in the United States of Utah, and it means a beehive. So the beehive concept, all bees work in a limited space to produce something sweet called honey. So they have projects all over the Middle East, Africa, and developing countries to do that. So with this, we'd like to show you some of our hospital, the ground floor. So this is the paid section, and you can see it's neat, clean, and looked after. There's the optical shop. And you can see the examination centers, the equipment. And then we have the super specialty wing, which is recently added. So there's Dr. Weber, Vitreoretina, there's pediatric ophthalmology by Dr. Aditya, and there is glaucoma services by Dr. Saiban, who will be joining us shortly. And then we have the clinics here. That's a retina clinic. And we have diagnostics area. That's where our scrub stations are, OT theaters. And then we have the basement. So even a charitable wing, it's very important, even if you do free work, it should be clean, hygienic, and attractive to the patient. They should get quality eye care, otherwise they will not come. So that's Mitt Romney. He's the work, Deseret, comes from Utah, and he's on the board of Charity Vision with which we are collaborating. So he ran for the US presidential elections and lost to President Obama, and now is a senator. So all the list of organizations that have worked with us since 1990. And you can see Dr. Bill Jackson, yesterday was his 89th birthday. So next year we invited him for his cataract surgery on the 90th by Dr. Reena from the US. So we get a lot of international volunteers who work with us. So this will give you an idea of what we have been able to do till now. We are nearly touching 673,119 surgeries and 95,672 spectacles. So when you add up, it means a lot, but it also means a lot of effort because as you know, community work takes double the effort than normal work does. So our motto is that the only thing worse than being blind is having sight but no vision. Most of our doctors spend all the time doing private practice. That's also required. But if you can go a little beyond that and do something community, because that's really great. And thank you very much for a patient hearing.